Hi, hello there. My name is Dr. Archana Lingannan, and I am board certified in Pediatric Gastroenterology, liver diseases, and nutrition. This means that I am a doctor who helps kids who deal with issues of the GI tract, which start with problems with food going in all the way down until the food gets out the other end. In this channel, I am going to be talking about issues of the GI tract, about certain questions that parents may have during my time in the clinic, what is the research behind that, and of course, I'm a mom myself, and I know that you have so many questions that it's hard for us to ask our doctors in the short time that you have in the clinic, and so I'm going to be addressing a few of those questions as well. In this channel, I'm also going to be sharing with you some of the tips and tricks that I have learned along the way of how to manage a very busy life of a working mom who's taking care of a 4-year-old and a 6-year-old without driving yourself crazy. Alright, so let's get into the channel. Well, out of the many moments that we have as parents, one of the happiest moments usually comes when it is poop day, but especially when it is soft poop day. And the reason that is because of one of the most common problems which we deal with in the pediatric population, and that is constipation. Your doctor may consider you constipated if you have lesser than frequent bowel movements than you usually have, or if you have hard, painful bowel movements, or if you see blood in your poops because of straining. You could have a soft bowel movement every single day and you could still be constipated. There can be many organic causes for constipation, which means that there is an underlying disorder which causes us to be constipated, and so constipation is just a symptom for the underlying disorder. For example, thyroid problems, celiac disease, you could have lead toxicity, nerve problems, muscle problems, anatomic problems, and other psychological problems. But the most common reason for constipation in the pediatric population is what is called functional constipation. There are many reasons why you could end up with functional constipation. As a child, a kid who's running around playing, right? They don't want to go to the bathroom yet. They don't want to poop yet. They want to hold their poop in. At some point, they're going to have at least like one hard poop, and then they realize, oh my God, it hurts for me to poop, and so I don't want to poop anymore. So they're not going to be pooping again. Kids just want to be in control of their life, right? And so all they can control is what food goes inside the mouth and when they're going to pee or poop. And so when kids feel threatened or they feel that they are under a stress, for example, when there is a new member of the family coming in, when they feel that they are in a lot of stress and they are not able to control the surrounding around them, then they try to find something else to control, and one of them is usually bowel movements. Toilet training can be very stressful for kids too, and so that might be a reason why they are getting constipated as well. Some of the other reasons are change in lifestyle, change in the diet, processed food, westernized diet, and a very strict toileting schedule in the schools nowadays, and the kids don't get bathroom breaks except for specific times in the day. Kids usually don't like to use the toilet in school because they have to stand in a queue. And all of these things compound together, worsen and worsen symptoms. When a kid over time is trying to hold poop in for many days, what happens is the rectum stretches out like a balloon, and then they lose the sensation that they need to poop. So they could be having like huge poops every single day, but they are still not pooping enough, and that's why they stay constipated over time. Sometimes you could see that they're having softer or looser poops, or you could see that they're having accidents. And the reason why this happens is because there is new poop which is being formed, which is not so hard yet, and that is getting through, and that's why we think, oh, they're not constipated or they're having accidents, but they're actually but the underlying reason is all just constipation.
There is an awesome educational video on YouTube by gikids.org. This describes in detail about constipation and encopresis. and I have actually included the link in the description below. So if you would like to watch it, you can definitely click below and watch it.
Any mom who has even mentioned the name poop or constipation to your doctor has heard the name miralax. Miralax is one of the most common medications which is prescribed by pediatricians or pediatric GI doctors for constipation. There is a lot of controversy going on about this medication, and there are many parents who ask me in the clinic if it is safe to use and how long is it safe to use. And so I'm going to be exploring what is the science behind this medication. Before I start, I wanted to let you know that nobody is funding this video. Miralax is not supporting me. I am not telling you whether you should be using Miralax or you should not be using Miralax. You know your children best and you are their best advocates. And so I'm only going to be presenting to you the scientific literature and my personal experience, and then I'm going to let you decide what you would like to do, and we are available if you have any questions. All right, so here are the questions that we are going to answer today. What actually is polyethylene glycol? How does it work in constipation? Is it safe to be used in kids? How long is it safe for? And do I use it in my kids when they are constipated? And if I'm not interested in using miralax, are there alternative options? All right, let's crack the nut, science nut, and get to the journal kernel. What does the science say? Miralax, miralax, miralax. Miralax or polyethylene glycol. Chemically, this is what polyethylene glycol looks like. The N signifies that that part of the molecule can be multiplied a number of times for it to be made into different substances. Commercially available polyethylene glycol is available in many molecular weights, which range from 300 gram per mole to 10 million gram per mole. You will see in the Miralax packets that it says polyethylene glycol 3350, which signifies the molecular weight. Miralax is known as an osmotic laxative, which means that when it passes through the intestine, it just pulls water from the sides of the intestine, which makes the poops softer, as there's more water in the intestines now. The reason why most of the doctors are comfortable using miralax is because it is known to not enter into the bloodstream and cause any issues. Miralax is usually not habit forming, and the reason is because all it does is just makes the poop softer by pulling water. And so if we are able to get enough of fiber in our diet to kind of do the same thing, when we stop using miralax, it's just that the water which used to be in the poop is not there anymore, and that's why we go back to having hard poops. And that's why it looks like we are dependent on it.
Time and again, there have been many studies which have shown that miralax is more effective than other options. It is also quite convenient because miralax really doesn't have any color when it is mixed in liquids. It does not really have any specific taste. I have personally tasted miralax in water before, and I can definitely say the difference between just regular water and miralax in water, but it's not very significant in my opinion. But kids can definitely feel it, even though it's not quite prominent. And then it's also benefits versus risks, right? And so what are the complications that you can have from constipation? There is a risk for hemorrhoids, for rectal prolapse, for encopresis, which means soiling. And so there are so many psychological and behavioral implications as well, because kids need to go to school every day.
In the early and mid-2010s, there have been certain concerns about the neuropsychiatric and behavioral effects of using miralax. So, in order for a medication to actually cause neuropsychiatric disorders, it needs to enter the bloodstream. So, when we look at the studies, which looks to see if there are metabolites of miralax in the blood,
if any toxicity, it is more because of the impurities in miralax or because of the metabolites of miralax, such as ethylene glycol. In this study, they actually checked the metabolite levels in about 9 kids who were treated with miralax and also 18 kids who were not on miralax. The metabolites they looked at was ethylene glycol, triethylene glycol, and diethylene glycol. And what they actually found was that the levels in both these groups were actually comparable. And in fact, the level of diethylene glycol was lesser in the kids who were treated with miralax than in the control group. The population in general is exposed to polyethylene glycol because polyethylene glycol polymers, because they are considered to be inert, are actually used as food additives, and they are also used in certain commercial products such as creams, lotion, and makeup. In 2008, when FDA tested miralax for impurities, they did find tiny amounts of ethylene glycol and diethylene glycol. The manufacturing of miralax has changed hands since then, and when they retested in 2013, they did not really find any detectable amounts of ethylene glycol or diethylene glycol. So, if it is less likely that the impurities would enter the bloodstream, then what is actually happening here? So, there are some theories that certain physicians have put forward. Uh, it is widely known that constipation itself can actually lead to a lot of behavioral problems, and there is research to support this. Kids who are usually being seen in the GI clinic for significant constipation sometimes do have other pervasive developmental disorders such as autism. They are not able to express their symptoms or their concerns effectively, and some of the side effects of miralax can be bloating, nausea, abdominal pain, diarrhea. And so it is possible that these kids are actually just noticing the well-known side effects of miralax, but they're just not able to express it, and so they have to express it through changes in behavior.
Miralax has been approved by the FDA to be used only in the adult population. In the pediatric population, it is used off-label, and this is a very common practice among pediatricians and pediatric GI doctors for many medications that we prescribe. There was a study which actually came out in 2007 by CHOP, which showed that by the Children's Hospital of Philadelphia, which stated that 4 out of 5 kids who have been hospitalized actually are given off-label medications. And the reason is because once you find that a medication is actually helpful in the adult population, it doesn't really sometimes make sense to actually go do an entire study in the pediatric population by where a subset of them don't get the medication which works. It doesn't feel humane, and so sometimes the medications just goes into use in the pediatric population. But
Even though the studies which are being done are not geared towards specifically getting FDA approval for the use of miralax in children, there have been many studies which have been done and continue to be done on the safety of miralax compared to other medications, the efficacy of miralax compared to other medications. I have included only a few references here, but there are many available. Most of these studies have looked at only the more commonly known side effects of miralax, such as nausea, abdominal bloating, abdominal pain, electrolyte disturbances, etc. There have not really been any specific studies which looks at the neuropsychiatric problems which might be associated with miralax. However, there are studies expected to be seen in the future regarding this topic. The longest duration that miralax can be used in the pediatric population has also not been effectively studied. At this point, the studies have tried miralax between a few weeks to a few months, and so further studies will also help to establish how long it is safe to use miralax in the long term.
am I prescribing miralax to my patients? Yes. Up till this point, there has been no studies which have come out which has shown that miralax actually is directly related to the neuropsychiatric problems that have been anecdotally reported. And also, most of the time, the parents who come to me have tried many things before. They've tried dietary changes, they've tried other medications, they've also tried like miralax itself, which hasn't worked, and just they need a little bit more help. And so at least until they are over the hump, we do prescribe miralax. And there are some kids who will have certain behavioral issues who will be needing and will benefit from miralax long term. I am also interested, and I'm waiting to see what the studies will be showing in the future. And Do I use miralax for my kids? Yes, I do use miralax for them. They do struggle with constipation, and so I have found it to be helpful, and so I continue to use it. And again, like I said, as a mom, I'm also waiting to see what the future research shows. And in the future videos, I will also be sharing with you what are the other things that I do for managing my kids' constipation. Is miralax the only medication? No, we have other osmotic laxatives. We have stimulant laxatives, which help squeeze the intestine. We have bulk firming laxatives, and we have stool softening laxatives as well. And I will be discussing about them in the future. Some of the behavior modifications that I recommend to my patients are to increase the amount of fiber in the diet, obviously, and the other things would be having regular toileting schedules. So sitting in the toilet after meals is the best time to do it because we call it the gastrocolic reflex. When there is food in the stomach, it kind of again sends signals to the rectum that it is time to empty, and so it kind of is a little easier to poop. And so having your child sit in the toilet after meals is usually helpful. The next thing is you must have heard about the squatty potty, and so sitting in a squatting position when you are having a bowel movement. Over here you can actually use short stools where the kids can keep their feet on so that their knees are a little higher than their hip, and the position in which the muscles are makes it easier to poop. In many countries like India, before the Western toilet became quite prevalent, we used to have the squat toilet, which still does exist there. And the reason is because that is the most best position to actually have bowel movement in. Alright, so let me know if you find this useful. If you had any further questions, you can put them down in the comments below. If you feel that you will benefit from similar topics like this, hit the subscribe button and the bell icon, and I will be exploring more topics on laxatives in the coming weeks. I will also be exploring some of the other alternative and natural resources which are available in constipation, and also what is there any research which is available for that. Until then, to work and be wealthy, you need to eat right and be healthy. All right, have a great day.